Red ear syndrome. What is red ear syndrome? Red ear syndrome is a red ear that also feels hot and painful, caused by more blood flow through the tiny blood vessels in the ear. Usually, only one ear is affected. Lasting up to 4 hours, it's possible to experience RES multiple times a day. Anyone can be affected by the condition, and while not usually serious, in rare cases it can also indicate spinal cord disease, diabetes mellitus, rheumatoid arthritis, and venous hypertension. Baby or toddler red hot ear. Redness, hot to the touch, and swelling can be a sign of various diseases. If these symptoms are joined by a high temperature, then it could be a sign of mumps, sixth disease, or acute otitis externa. If the child is too young to talk, then it may not be obvious that their ear is painful, so look for signs of regular touching, irritability, and constant crying. Important: contact a doctor or 111 straight away, and avoid a hot or cold compress on the ears, washing, or any DIY remedies until you have been seen. Symptoms. The temporary symptoms listed below are not concerning on their own, and won't last very long. One or both ears are red and warm or hot to the touch. If you also experience any of the following red ear syndrome symptoms below, then these are more concerning and you should see a doctor. Swelling or tenderness. Burning or throbbing sensation. Itching or irritation. Flushed face or hot cheeks. Causes of red and hot ears. Red ear syndrome, or just red hot ears, can affect anyone and the cause can be varied. Causes that you may be affected by are as follows. Emotional flushing, more stress, embarrassment, or anger than usual. Increased blood flow, a sudden change in temperature, alcohol, spicy food or exercise. Sunburn. Sleeping on the ear, usually when the surface isn't soft enough. Friction from wearing headphones, hats, or even hair products. Medical causes. The previous causes are usually because of something you have done yourself, whereas the following list is because of a medical condition. Ear infections. Allergic reactions. Skin infections. Hormonal changes and menopause. Perichondritis, swollen from an infection following surgery or piercings. Relapsing polychondritis, swollen from an autoimmune disease. Erythromelalgia, burning pain from genetics. Treatment for red and hot ears. Red and hot ears are a fairly common temporary condition that can come and go reasonably quickly. So, treatment isn't something that needs to be considered, but we have listed a few things that you can do if you wish to speed up the process. Home care measures. A softer pillow can reduce or remove the chance of it happening overnight. If wearing headphones, try larger ones that completely cover the ear to avoid irritation. Cooling techniques. Sunburn can be treated with a damp flannel for 10 minutes, while also applying a gentle hydrating moisturizer containing aloe vera afterwards. Even without sunburn, ice packs may help to calm the area down and numb any pain. Avoiding known triggers. While some triggers may be unavoidable, such as exercise and alcohol, keeping your ears warm in cold weather with earmuffs or a hat will ensure they don't struggle with the temperature change. Treatment for red ear syndrome. Unlike simply red and hot ears, which can usually be treated at home, red ear syndrome will need medication to resolve the issue. From the doctor, antibiotics will be provided for infections, which should help very quickly. Neuropathic or anticonvulsant medications may be supplied to calm the nerves if they are causing an issue from being overactive. Strong anti-inflammatories may be supplied to control veins or headaches if these common causes are the issue. Nerve blocks, numbing cream, and even Botox could be used as an effective solution as backup measures. Over-the-counter, pharmacies will be able to help with creams for eczema or dermatitis. They can also supply antihistamines for an allergy that may be the trigger. Prevention tips. While there are a lot of causes that can't be prevented, some basic prevention techniques can help to avoid flare-ups from lesser causes. Protecting ears from sun exposure. Managing stress. Avoiding irritants and allergens. Good ear hygiene practices. If you're unsure about what's causing the issue, write down what you have done and eaten to possibly trigger the issue. You will soon start to see a pattern. When to see a doctor. While red hot ears are common, you should see a doctor if you also experience any of the following: persistent redness or pain, fever or discharge, swelling after piercings or injuries, hearing loss or dizziness, symptoms spreading beyond the ear, or frequent unexplained episodes. Conclusion. Most cases of red and hot ears are harmless and temporary, as red ear syndrome has only been recorded 100 to 200 times since the 90s. If you are experiencing persistent symptoms, they should be evaluated to identifying the trigger, which is also helpful if you need to see a doctor.